Well, good afternoon, everyone. I'm pleased to be here today as we look ahead to Tynwald Day, and for many, a long weekend to spend with family and friends. This should provide an opportunity to reflect on the challenges we've faced as an island over the past few months, to think about how far we've come, and that the reason that we are able to get together is to thank our community's collective commitment in getting us to where we are today. As life has begun to settle and feels largely normal again, the island's border restrictions remain a major policy challenge for the Council of Ministers. The situation continues to be complex. Tough conversations have taken place with strong emotion on both sides of the debate. Last Thursday, I said I would bring you more news regarding the 5-stage framework we have in place to provide a safe and controlled pathway to opening up our borders. I will come to that and other matters in a moment. But first, I would like to invite the Minister for Health and Social Care to run through today's numbers. I know that the Minister also would like to share an update on the maternity ward. David.
Thank you, Chief Minister. The total number of tests undertaken stands at 6,558. The total number of tests we have had back is 6,547, so we are outstanding 11 test results. The total number of confirmed cases remains at 336, with no new cases identified. In relation to maternity ward and services, we do appreciate that it's been a very difficult position for many ladies who are giving birth, not being able to have the support that they would have had in normal times. And I would like to thank people for bearing with us while we turn services back on. I'm delighted to be able to announce that with immediate effect, we have removed the restrictions around birthing partners. They have now been lifted. There will also be visiting on the maternity ward for one person from the hours of 6 to 8 p.m. each day. The only thing that we will be asking is that those birthing partners remain with the lady giving birth throughout the entire period, and that they don't, as they could pre-COVID, nip in and out as they wish. We will be asking them to remain with the lady for the entire period. But thank you once again to everyone who has bared with us as we get our services back to normal. We appreciate it has been a very difficult time for those involved, but we're delighted to be able to say we've been able to lift those restrictions today. Thank you, Chief Minister.
Thanks very much, David, and that's excellent news. Now, last week I said that the Council of Ministers would look once again at our borders policy. I said that we would consider if we were ready to take the next step in allowing more movement in a safe and controlled way. The Council of Ministers discussed this in detail today. We looked at relevant data and we considered the situation faced by our near neighbours and further beyond. We have decided that we were not ready to move from level 5 to level 4, not least while so much uncertainty remains in the United Kingdom and elsewhere. We may be close, but we are not yet there. I'm aware that this will be a relief for some and a frustration to others, but in line with our approach right up to this point, we feel it is better to be cautious. New cases have caused spikes in certain areas in the United Kingdom, and we are not willing to jeopardise our position while this remains a developing situation. But we do know that we cannot keep the borders as tight as they are forever. The Council of Ministers will consider this again next Thursday, and I will update you then. Staying on borders policy, the Council of Ministers did agree today to lift the restrictions on the number of residents who can return each week. This move is designed to speed up the return of those who have been approved to travel under the existing rules for returning residents. We want to bring those last people home before we take any further changes. We will be making announcements in the coming days on how this will happen for those already in the system. But please remember, the border is closed to everyone other than those who have specific exemptions. You will only be granted entry to the island if you have a valid exemption. I would now like to move on to testing and a slight change we are making to ensure that we get the earliest possible warning of any cases on the island. Testing remains the cornerstone of our strategy against this virus, and it is vital that anyone who has symptoms calls 111 to arrange for a test. It is always better to be safe than sorry. We know that some people may be reluctant to do so because they worry that even if they are negative, they would have to self-isolate for 14 days. So from tomorrow, a new process will be in place for any one of us who has been on the island for more than 14 days who thinks they may have COVID-19 symptoms. Now, when you call 111 because of the symptoms, the team will arrange a test as usual. But now, rather than instructing you to self-isolate for 14 days, regardless, the team will ask you to remain in self-isolation until you get their test results back. If the result is negative, and as long as you feel well in yourself, you will no longer be required to self-isolate by law and can go back to work or school. If the COVID test is positive, then of course the process remains unchanged. 14 days self-isolation along with any members of your household, and the contact tracing process will begin. This change has only just been agreed and the website will be updated with the latest information by the end of the week. As more everyday activities take place, it is important to take a step back and remember that although our Manx bubble is free of COVID, it doesn't make us immune from coughs and colds. We are mixing with each other in close proximity again, and bugs are always about. It is unavoidable. What we can do is to ensure we stay responsible by maintaining good levels of hygiene. This is just not about COVID. It is just the right thing to do. Remember to catch it, bin it, kill it, and wash your hands frequently. Many services available at our hospital are beginning to resume, and I am grateful for those who have worked hard to make this possible. But we have to remember that the process can take longer in some cases than others. I need to ask everyone out there to remember that all our health and social care staff, who have been under a great amount of pressure in recent months, are doing their absolute best to return services to normal. Please bear with us and show understanding when inquiring on the status of appointments. These people do deserve our respect. I would now like to open up to questions. And first today we have is Leanne Cook from 3FM. Leanne, good afternoon.
Good afternoon, Minister. I hope you're well. You've answered my first question. I was going to ask about birthing partners in the maternity ward, but you've answered that, David. So, my second question is for the Health Minister, though, please. I was just going to ask if you could clarify the current procedure in regards to doctors' appointments. I just wondered if they're still implementing social distancing in these types of settings. It's just as we've heard mixed reports and some people aren't sure what to expect if they have appointments.
So in relation to doctors and GP surgeries, at the moment they're still doing the telephone triage. So they are checking what people require via telephone and then inviting in for physical appointments those that the doctors themselves believe they need to see. When people arrive at the surgery, we have now removed social distancing as a department policy, but if the doctors' surgeries themselves feel it's more appropriate for that to continue, then they're fully free to do that, but it's not something that's been mandated by the department. So you may find different surgeries will take different approaches.
Okay, thank you. And my second question is for either of you, really. It's just in regards to entertainment on Ireland, for example, the Villa Gaiety reopening. For the likes of entertainers, musicians or artists coming over to the Isle of Man, just wondering if any thought's been given to if they'll have to isolate or will they be able to come over and then leave?
Well, I suppose this is being worked on at the moment, Leanne. I don't think there's a clear policy on that. So at the moment, I think they will have to quarantine. I don't know, Dave, if you've got any additional information.
Yeah. Under the current rules, it would be exactly the same. They would have to quarantine. Also, equally, it would depend whether they meet the key worker exemptions for them to be able to enter the island as things currently stand. Obviously, a lot of the shows that are going on aren't starting up really until around about late August, September time. It's very hard to predict that far in the future what the situation is going to be. But at the moment, they would have to comply, firstly, with the key worker policy to be able to enter the island. And then even if they complied with that, they would have to self-isolate. And there would probably be restrictions around what they could do in any performance because of obviously the need for them to social distance.
Yeah,
Okay,
so
thank you.
I sincerely hope that we are in a position that come September that they can move onto the island, but let's keep fingers crossed on that. So next we have Amanda Cashmore from Jeff the Mongoose. Good afternoon, Amanda. Faster Mai.
Good afternoon. My first question is for the Health Minister, if that's okay. There are some scientists who believe the T cells in our immune systems have been used to fight the virus rather than those testing positive for COVID-19 developing antibodies. Are you considering undertaking COVID-19 T cell testing as well as antibody testing to get a better picture of those who've been infected on the island?
Well, at the moment, in relation to the T-cells research, it is still very early days, Amanda. So we need to see more firm evidence of that. There has been, as you rightly say, several scientists now from across the world that have actually come forward and postulated this. But at the moment, we are sticking with the antibody testing. Of course, the whole point of the antibody testing isn't to tell someone whether they have had COVID-19, because there's no automatic immunity inferred in that. It is a population study. But we are looking at the interesting results that are emerging in the scientific community around T cells. But as a small jurisdiction, we will need to see where that goes in the larger jurisdictions first.
Thank you very much. And secondly, for you, Chief Minister, for anyone coming onto the island granted a key worker exemption from strict quarantine, can we expect to see testing when they arrive in the next few weeks? We know it's not 100% accurate to test someone when they arrive, but as we have the testing capacity now, does it not make sense to be as safe as possible?
Well, obviously, we take advice, Amanda, from our medics on that. The testing situation only tells you the situation on the day that the test is carried out. It doesn't say that whether the person has COVID or not. And therefore, it's not something that gives you a really good, safe record of that person's position. But obviously, this is something that our medics are looking at. And if we feel the need to change to that system, obviously we're looking at all sorts of new systems. The Guernsey are trying a model out later on this week on 7-day isolation and then having a test. So there's quite a few thought processes going on making changes, and we'll announce that once we feel comfortable that it's the safe and right thing to do.
Just to go back on that, though, I'm not suggesting that those people wouldn't need to social distance anymore, but seeing as we have that capacity, does it not make sense to test them? And then if they are negative, you know that you need to go in strict quarantine.
Well, it's something that we can do. The only problem is if we do testing at the borders, which has been a question that's been asked time and time again, we're taking medical staff away from the hospital or the job that they're carrying out to do the tests, which is something that we're reluctant to do. But if the advice that we are given is that the test will be a safer way of doing things with visitors coming to the Isle of Man, then of course we will look at that. I don't know, David, if you want to add anything on that topic.
Yeah, just to very quickly add, Chief Minister, of course, one of the key things has been around the 14-day self-isolation for those entering the island, and even with key workers outside of their job, they have to self-isolate for 14 days. That's regardless of whether a test would come back positive or negative. So at this stage, testing wouldn't actually add anything to that. They would still be required to do the 14 days. We constantly look at our testing pathways to see if there's, on a risk-based approach, something we can do differently. The Chief Minister's already announced a change today for those who are on island for 14 days. But for those coming into the island, we're not willing at the moment to relax the 14 days self-isolation, because we believe, along with border control, that has been one of the biggest impacts on us being able to get where we are today.
Thank you.
Okay. Thank you very much, Amanda. Now we move on to Josh Stokes from ITV. Good afternoon, Josh.
Good afternoon, Chief Minister. We were originally told the 5-stage document on borders was to be released publicly last Friday. We still haven't had full confirmation on exactly when that will be published. And the government is arguably at its most comfortable stage now of the pandemic, where the island has no active cases. The majority of people are now going about their day-to-day in a somewhat normal fashion. So is there a deliberate delay here on borders with more of a focus on the government's ongoing reputation? Because whatever you do now going forward with the borders, the island will be at its greatest risk of a second wave. So is there a balance there between the government's reputation amongst the public and the plans now going forward, especially given you've also said you're not willing to drop to stage 4 at this stage?
Yeah, well, first and foremost, Josh, I don't think I'd ever say I'm comfortable. There's always plenty going on, and as you've rightly said, the borders is a very hot topic. We always do what we believe is right with all the evidence and the information. I don't go in for popularity stakes. It's what is right, and as a Council of Ministers, we feel that with the situation in the United Kingdom at the moment, we're not quite ready to move from stage 5 to stage 4. We've looked at that data. We hope to be able to move fairly soon. And I think in a week's time, we'll hopefully see some of the information that we're looking for to see whether we can make that move or not. So, yes, it's a tough decision to make, but we will make it based on the best evidence and never worrying about our reputation. It's what's right for the island. And whilst we've got to be cautious, equally we can't be too cautious. It's just getting that, it's the Goldilocks syndrome, isn't it? We try and get it just right each time. We don't always get it right, but we do our very best.
Okay, just a supplementary to that, we keep hearing it needs to be safe enough, but what exactly does that look like? Is it the number of cases, number of deaths? What is deemed as safe in the UK?
Well, we're looking roughly at an infection rate that's happening in the United Kingdom. So it's 1 in 2,000, for example. Now, the most recent figures, they're there now, but they're slightly late, and the statistics in the United Kingdom show that at best they've plateaued. There has been a number of increases in, and you've seen Leicester, certain wards of Leicester shut down, and expected spikes in other regions in the north and the northwest. So I think when we've seen the next week's figures, then we'll be a little bit more confident should we make the change.
Okay, and my second question is that there certainly seems to be quite the celebratory atmosphere on the island still, and with no future plans or procedures that we're aware of for a second wave here, it does beg the question to how willing you think the public will be to comply with future restrictions again, if or when future measures may need to be brought in. Is that a concern?
Well, obviously, it is a concern, but I mean, I have no reason to doubt the Manx public. They've been fantastic. They've followed the advice and requests that we've made. Hopefully we won't get into that situation, but we have planned. That's why we've put the letter out to all households, clearly showing what to expect if we see a significant, an increase in numbers on the Isle of Man, what they should expect to happen in their lives. But we sincerely hope that if everyone clearly follows the 14 days quarantine period properly, then we will not have a situation where we will have to reintroduce any of our measures.
Okay, thank you.
Thank you very much. And next we have is Sam Turton from Isle of Man newspapers. Good afternoon, Sam.
That's right, Chief Minister. I just wonder if we could start with a few of our readers have mentioned to us, and I just checked the website here, it's still saying the same thing. The Steam Packet are selling tickets on sailings to the island as of the 15th of July, and indeed they appear to be showing that they're going to Liverpool on the 17th of July. Given that the Treasury is the shareholder, it's the only shareholder in the Steam Packet, and that the Steam Packet will have worked with government so much on border controls, should we take this as a potential indication that that is where we'll be going in the next 2 weeks?
Well, no, not necessarily. I've just announced now, Sam, that there will be, for those who have the right to have left the island to come back, that there will be no longer next week. We'll be announcing the exact date. There'll be no longer the restrictions that you can only come on a certain day, and the lifting of 50 passengers on the boat. We are now going to be allowing people to come back next week. We'll announce the date any time, and there'll be no restrictions in numbers per week, and that will make a significant impact on those people who've gone away, maybe sadly to see a relative that's either funeral or seeing them before they pass away, and they're having to wait a week or two. With the changes that I've just announced now, it means that going forward next week on the Steam Packet, you'll be able to come back from any day of the week, and the number 50 will be increased significantly.
Okay, thank you. And secondly to Mr. Ashford, please. In terms of the antibody testing, where are we at this stage now? I know we said by the end there was a target for the end of July. Where are we at this stage now at the start of the month, and where do you plan to be by the end of the month?
So at the start of the month, Sam, we are now at the point where we've done around 3,000 antibody tests, 2,000 to go, which will be completed by the end of July. We are looking to get an interim report out because we have enough information now. Hopefully, the start of next week, we're now hoping. So it will be quite interesting. We'll be able to get the public findings out there so far. And then obviously, once we've completed the full 10,000, then we will actually look to get a full population report out so we can get out to the public how far COVID-19 has spread across the island.
So at the minute, is there an indication that the levels are about right and where we believed we were of testing, or is there an indication that it may be a little bit higher at all? Or?
We're actually ahead of where we expected to be at the start of this month in terms of the antibody testing. At this point, initially, we were expecting to be around about 2,500, so we're roughly around about 500 tests undertaken ahead of that.
Thank you.
Okay, nice try, Sam, to try and get more information out of the Minister.
Never any spoilers from me, Chief Minister.
Right, and last but not least, we have Alex Bell from the BBC. Alex, over to you. Good afternoon.
Thank you, Minister. Well, we were hearing that the UK is considering this traffic light system for countries where holidaymakers from there can go to. Once the borders do open, can we expect the Isle of Man to apply any kind of different restrictions to people who come in from different countries?
Not at this. Well, at this moment in time, the next stage is to allow the movement of people from the Isle of Man to go off the island without any requirement to give a reason. They'll have to book to go off the island, fill out a form, print it off, and take it with them so that they can come back unhindered. But we're quite a stage down before we get to A, opening our borders, and B, deciding whether it's a free-for-all or certain countries. Who knows where the UK numbers will be? The vast majority of people will come through the United Kingdom to get to the Isle of Man, and therefore, if we're allowing that to happen, then it probably will be all the United Kingdom's figures are relatively high compared with the rest of Europe, and therefore if we're allowing the UK in, it'll probably be everyone. But never say never. We don't know what's round the corner, Alex. You could have a second wave in a jurisdiction which severely restricts our ability to allow them to come. But we'll just have to play that as we find it on the day, really, Alex.
Thank you. And the second question, I don't know if it's more for the Health Minister or for yourself, it just concerns this change you're making to the testing-based self-isolation requirements that you mentioned there. When is that coming in, sorry?
Well, David will give you the greater detail. One of the reasons we brought it in, Alex, is that you've got young people going to school, maybe having a cough, the school sending them home and the parents having to ring up 111, and then they have the test, it comes back negative, but the family, the young person can't go out for 14 days. Now, we all know what young people are like. You believe it or not, I was one once, and we can get a bug, and 24 hours later, we're feeling absolutely perfect. But if that bug shows any similar symptoms to COVID-19, we've been making that person, the household, shut down for 14 days. And we're trying to encourage people that if they think they might have it and they haven't, to come, instead of staying home and thinking, well, I don't want to be isolated for 14 days, they'll come forward, have the test, and if they don't have it, and the symptoms have gone away, then they will be able to move freely around. And David, if you want to expand on that.
Yes, thank you, Chief Minister. Just to say, Alex, that obviously people who've been on Ireland for the last 14 days, their risk profile is very different to those who may have been travelling elsewhere, because we haven't had any confirmed cases. So it's sensible now to move to that position where if people have been on Ireland for over 14 days, they have no travel history, then it is sensible that if the test comes back negative, we can assume pretty much that is accurate. In terms of doing it a different way, if we carried on the way we are, if you had a household, say, with 3 children, it would only take a couple of cases for households to become permanently locked down into 14-day isolation. And with the economy returning, people needing to go back about their daily business, it's just not practical. So we take a risk-based approach, and for those who are on Ireland for 14 days or more, this is a perfectly acceptable risk-based approach to take.
Yeah. I suppose the question I was getting at, though, there can be false negative results, can there? So it would only take one person who in fact had it to spread it within the community again.
But if people have been on Ireland for 14 days, bearing in mind we have low to zero community transmission because we've now got over 40 days without an identified case, then the risk is exceptionally low. If we started identifying cases again on Ireland, then obviously, as with every decision government makes, we would have to review the position.
Yeah. Okay, thank you. And just for clarity, when is that change coming in?
So the change is coming in from tomorrow.
Thank you.
Yeah, it's at the end of the day, Alex, it's common sense, really. If we implemented the current policy with schools back now and virtually 100% of all our young people back at school, then we could see a situation where a third to half the school are off because there's a cold going around. So we're trying to be as reflective on the situation as possible. The fact that we have a fantastic situation where we haven't had any cases for over 40 days would show that if a young person goes down with a high temperature or a cough, etc., then it probably is just a bug which does the rounds around the school and will be gone in a short period of time. So I hope people see that this is us trying to be a common sense approach and be as flexible as possible while still protecting the health of the island. Well, thank you all very much, and thank you again for joining us this afternoon. We know that these press briefings remain popular, and they will continue. As Monday is a bank holiday and attention will be focused on the Tynwald Day ceremony in St John's, the next one is scheduled to take place on Thursday. Statistics will be published tomorrow and will then pause for a long weekend before resuming on Tuesday. In the meantime, I hope everyone has the opportunity to take some time this weekend, particularly as we celebrate our National Day, to appreciate how far we've come and the collective effort involved in getting us here. For some, Tynwald Day is a ceremonial occasion to be marked solemnly in recognition of our national identity and long, proud history. For others, it is marked in the calendar as a chance to mingle, have a drink and catch up with people we haven't seen since the previous year. However you choose to spend Tynwald Day, maybe take a moment to reflect how we have proved that one island, one community, and how we've done so well. We have responded to an unseen threat and have looked out for each other. Everything we have achieved together. We have done this by understanding the risks and making the right decisions for our community. We work together for the good of our precious island, and we must continue to stay responsible while navigating the best way forward in what is a constantly evolving situation. Thank you all very much.